Well, good morning, everyone. This is usually a session that's done in a small seminar type of a room, and here we are in Ballroom C. So those of you who are scattered around the various corners of this mammoth room, it would really help us in our session if you could come a little bit closer in so that we can see you, you can see us. And this is meant to be partially an interactive session, partially a more formal session, but it works much, much better for you to be able to see us and we can see you. There's lots of bright lights here, which makes our vision a little bit more difficult. So please do join us for what will be a symposium initially, and then we'll have a breakout session near the end of the hour, and I will introduce ourselves a little bit more formally, but it's great to see you here. I am Dr. Bill Hafner. I'm editor of the journal Military Medicine, and this session is to become a healthcare journal author or a reviewer. And as I said, this is a panel session and also breakouts. The required disclosures, of course, we have no financial relationships. The continuing education activity is managed by PSEG, and none of us have any support, products, whatever, to conflict with us, and there's no commercial support for this activity. Your faculty include myself as a faculty member at the Uniformed Services University, and I will introduce myself a little bit more formally when my part of the program comes up, and I've asked each of the panelists to introduce his or her background as our portion of the program follows along, because we represent all disciplines. For five of us, we represent 5 different disciplines, and yet we're all associated with the journal Military Medicine. The journal has a long history. It is dated back almost to the start of AMSIS, so almost 120 years of history. It was military surgeon. We are much broader than military surgeon. It's now military medicine, but we're much broader than military medicine. We are healthcare, federal healthcare, really, and it's an international journal of healthcare in the federal context. So to lead off the discussion, I'm going to ask Dr. Lessing to take the session from here.
Thank you.
Please introduce yourself.
I will. I'm Captain Melvin Lessing, United States Public Health Service retired, also the assistant editor of the journal Military Medicine, and I'm a pharmacist officer. Perhaps you've all heard the story about the cub reporter whose first assignment was given to him by the editor, who wanted to make it very simple, and he sent him to cover a dog show. And he said, it's a very simple assignment. All you have to do is write down the name of the owner, name of the dog, and whatever award they won, and we'll print it. The reporter came back and said, there's no story. And the editor says, what do you mean there's no story? He says, well, there's nothing to print, there's nothing to write. And he says, why not? He said, well, somebody stole all the dogs. The learning objectives for this, as you can see on the stage, on the monitor, is to understand the importance of publishing our work, to select the appropriate format, which will be discussed later on in the program. There will be several key steps in the preparation. Obviously, when you want to present something, when you want to submit something to the journal, there is a definite format and way of doing it. And also relating the activity as a reviewer and also an author. And I will say most of the people, or certainly are both, the people both present material to the journal and also serve as a reviewer. Now, this is the disclaimer slide, which tells you that the our opinions are our own. Clearly, they're not that of AMSIS or any federal agency, and that we are obviously, as I say, our own opinions. Our people that you see on stage, and most everyone associated with the journal, have had long careers with them. They've published, they've reviewed, and they have done many other projects for the journal. This just expands on the previous slide at first. Our collective view sort of delocalizes the blame in a sense, but again, we are presenting our own views and not that of the journal or of the agency or any federal agency. I don't know the collective years of everyone here. It's probably several hundred if you consider the amount of years we've had involved with federal health. We've all published significantly with the journal, and these are, again, our personal reflections. So one more slide. Okay, the first thing it says here is federal medicine. Federal medicine is different from any other medicine. Your local doctor does not treat wounds from shrapnel or from explosions, et cetera. But in addition to this battlefield, we're referring to any type of natural disaster or any place that the military is involved. It also means caring for military people who have been injured, Veterans Administration, for example, or any of the military hospitals. Military medicine is to promote the awareness of this federal medicine. It gives us different types here: operational, applied, public health, and so forth. The journal covers all these areas, and it's a niche journal. It is a journal that is for people in public health, specifically federal public health. And I think it is the only journal that will cover these areas. The mission of the journal, first of all, of course, it is peer-reviewed, and that's very important because it means that each article that is submitted to the journal, each manuscript that's submitted, is peer-reviewed by at least 2 other persons in that area. Some cases, there may be 3 or 4 people reviewing it, but nothing is ever published without peer review, so you can pretty much assume that the authenticity and the accuracy of what's being published, certainly within the confines of what the current state of the art is. Now, the mission is to increase healthcare research and education, which it does certainly by the articles, facilitates communications across many fields. Our journal covers all disciplines. Obviously, medicine, dentistry, pharmacy, nursing, public health, all disciplines are covered by the journal. And it is a prestige journal. It is a journal that, as I say, there's no place else that you can submit to. A person can submit clearly to his own discipline, to their own discipline's journal, but it will not be reviewed, will not be seen by other people in your profession. In a sense, I think in terms of eBay, where someone may have an obscure object they think that no one else would ever possibly want. There's someone on the other side of the world that's just looking for that particular object. You may publish something on what you're doing and thinking no one else cares about it, but you'll publish anyhow. Someone else totally unknown to you is just waiting to get that information. Here's probably the main question. Why publish? Why do this? Well, these questions can be put as it says, invaluable process of an answerable question, even an unanswerable question. Someone else may be able to write into the editor and say, I can respond to that manuscript, to that publication, and here's what's missing. Everyone benefits when that happens. Obviously, reviewing pertinent literature. People publish all over the world, but if someone collects just the literature on that particular very insignificant point, there may be some knowledge collected that when put together may answer a question that otherwise would not be answered. Gathering and evaluating data, of course, and conclusions and discussions. Now, all of that relates to the next 2 points, advancing knowledge and sharing information. That is the purpose of science, that no one has to reinvent the wheel. You can disseminate the information you know to other people, to other persons, and provide outcome basis for changes in military federal health care. Now, I remember in my first semester in organic chemistry, the professor got very excited about a compound that was made up of 4 inorganic elements. And he was saying, this is the best stuff in the world. You can't, they're all in their highest oxidation state. You can't burn it. You can't destroy it. It's the greatest thing in the whole world, should be made out of it. And the compound was asbestos. Obviously, the more knowledge we gain, the more likely we are that we can change, hopefully for the better. You want to provide a searchable reference record. Obviously, other people are going to be reading what you published in their areas. You want to promote career enhancement and academic curriculum vitae enhancement. This is very important. In academia, the key phrase is publish or perish. In federal medicine, you don't perish, but since you are competing for promotion, it never hurts, and in fact, it does help to have on your curriculum vitae a list of publications to show that you not only have done your work, but you've taken the extra effort to prepare a manuscript, submit it to the journal, and have it published for others to use. And as I say, in federal medicine, it certainly is worthwhile. Supplement current experts in the field, of course. The uniformed services fitness reports will same thought, and contribute to the effectiveness of the team. The team may be not only the people you're working with, but there again, somebody in another service, the other side of the world, but who's working in that same general area, and your work may be extremely helpful to that person. Professional curiosity is something I think is very important. I have read many articles on pharmacy because I am a pharmacist, and I will leave you with a question. Well, I will answer a question after I propose it, and that is, you've all seen these globes in pharmacies that have color solutions in them. Does anybody know why or what function they serve other than to tell you that that business is a pharmacy? Okay, in the 17th and 18th centuries, usually a pharmacy was on the front street of these little towns or communities, and when there was a plague in the community, those globes, the color was in there was red. So anyone passing through the town would see the red globe and know not to stop, that there was some disease or plague going through it. This is the kind of thing you learn. Again, it's just professional curiosity. They don't teach that in school. And I will just thank you for listening and have our next presenter.
Thank you, Mel.
Right, certainly.
Well, good morning. I'm going to help you take now that you hopefully understand what the reasons are for publishing, what the advantages are to you. How do you get into the journal's state of mind? The first thing that's important to you, I forgot to introduce myself, I'm sorry. Tony Gellish, retired Lieutenant Colonel, Air Force Medical Service Corps, 23 years active duty, and I'm a life fellow in the American College of Healthcare Executives. The important thing is to spend time looking in military medicine and reading the articles in military medicine to get a sense of what the expectations are for our audience. As Dr. Hafner mentioned, it's been published over 100 years, and between the editorial boards we've had over the years and the content we've had, there's a pretty good sense of what our audience expects, and the journal reflects that. So it's important to be familiar with the journal itself. One of the mechanisms, and I'm going to go through the mechanisms first and then talk about how you might go about selecting them. One of the mechanisms is the brief report. These are generally heavily data-intensive analyses. They're 4,000 words or so. When we say reasonable number of tables, recognize we don't have unlimited space in the journal. So the tables should be something that's illustrative to the audience that's going to be reading the article, so it doesn't necessarily reflect all of the data someone might have collected. And hopefully it would be addressing a new topic in full. We also have feature articles. These are the ones I really prefer, although that I have no judgment as to what goes into the journal, but as a reader from the editorial board, I enjoy reading these because they are revealing new things. And so there may be something you've come across in your experience where you would want to share that, as Dr. Messing was mentioning, and you'd want to share it with a broader audience because you have had this experience and you haven't seen anybody else do anything quite as interesting. So you have to look as you're doing a feature article, any ethical issues. You can't have control groups where one control group is suffering while the other control group is not suffering, those kinds of things. You all know that. Many of us, I believe all of us, should have institutional review boards that take a look at the construct of the study and make sure that it meets all the ethical guidelines of your enterprise, your institution. The study design is important in that it should follow conventional analysis processes. The statistical analysis, you probably want to get someone who's familiar with statistics if that's not your specialty area. I'll talk more about that in a little bit. You end with a discussion and conclusions piece, and then of course you have to get releases to be able to have this information published. Sometimes there are restrictions, again, by the enterprise or agency for whom you work. The brief reports are short, and it may be the beginning of a study you've started, and you don't have enough information to say, I know something, but you think you're on the track of something. And so you may want to publish a brief report in the journal. Generally speaking, we try to publish the abstracts in the journal and put the full report online so that it's searchable and people can discover what you've discovered to that point, and maybe it'll motivate other people to pursue some research. Case reports, occasionally you'll come across a patient situation. The one I remember the most from my youth is margarita dermatitis, which I was unfamiliar with. It's a certain kind of lime out in the South Pacific. If you get it on your skin and expose it to sunlight, you get chemical burns that look like you've gotten into something really, really nasty. That was not widely known where I was in the Pacific, and we had a lot of cases of it, and the fear was that a chemical had gotten loose on this island and that the kids were playing in it. And now we had a pollution problem, we had an environmental problem, and it turned out it was just these tiny, very intensely flavored limes that I think it's photosynthesized, I forget what it is, but anyway, it reacted to sunlight and caused burns. So, interesting case study. How did they discover what it was? All of this was done remotely by telemedicine, so it would be a great case to work up. There are review articles where people do reviews of the literature and come to interesting conclusions. They might see trends in the literature that other people have not seen. They might see a study that somebody has done up to a point and realize that there's something more that could be done, and so they'll produce that additional review of the articles and say, this is sort of a trend I saw, interesting thing to start discussion, for example. Guest editorials and perspectives. You may have a point of view that you feel is very important to share with the military medicine audience. Again, familiarity with the journal will help you understand what the audience expectations are and how that might fit into what you're doing. And then letters to the editor. The processes, if you have not been through it, can be very interesting. I have had the opportunity to review articles that were not suitable for publication and have to figure out a way to tell the person that they shouldn't be writing. So you have to be prepared for that. The board has an obligation, the peer reviewers have an obligation to the board to make sure that what we publish is high quality. The journal has a reputation to maintain. And so you may get busted up in the process of having your document reviewed. What I've seen is that the very best articles that I've seen published in the journal have been those that got the strongest critique at the beginning, but the authors were very resilient and came back and really embraced the criticism and really improved the paper. And what I've also subsequently seen is that they've published again because now they understand how the process works, and now it's not quite as ego-bruising as experience as it used to be. And it's hard to determine importance of a work, so we tend not to talk about importance of authors' work so much as relevance to our military medicine audience and how it fits into the categories that Dr. Hefner is going to talk about later. And be sure and follow the published guidelines later. Tanya will be available. She can walk you through that and make sure you understand that it's all online now. So a lot of it is much simpler than it was in the old days when we had paper. Remember that we have a general military audience. So we've got medical service corps officers, we have nurses, we have public health service, Air Force, we have international readers, and so try and think about what's going to be relevant to them and how it would transfer information to them that would be useful to them. So I was a supply officer, a logistics officer for most of my career. It was very useful to me to read orthopedic articles about the various hardware that you use for stabilizing orthopedic injuries. So I was buying that stuff. And I would know that you don't ever buy 2 of something, you always buy 4 of something because everything has to be equidistant pressure and stuff. And so, very informative for me, and military medicine was a good source of that. Avoid creating a synopsis of the article, avoid using the abstract of the article as an introduction. It should be a synopsis of the article, 300 or 400 words. Gives me a chance as a reader to say that's something that's of interest to me, or maybe it's not of interest to me now, but I may want to get back to it, and I know what I can expect from the article when I get into it. Be careful about lengthy introductions. Remember, again, we don't have unlimited space in the journal, so it's eating up your space. You just want to give enough background to bring the reader into the story. They've had the abstract, they know generally what it's about. Now there's an introduction that says, okay, this is what you're going to see in the discussion and the conclusion and how we're going to go into this. One of the hazards, because we're in the medical community, we're in the military community, is use of acronyms. Recognize that I saw that this morning with some acronyms. It was like, I don't know what that means. So I looked it up. But anyway, be careful about that. Be sure and spell them out. Avoid them if you can. And make sure that that's something that people can find. One of the things I wanted to talk about, that I skipped over, is, I'll get back to it. Conclusions must match the data. One of the things I've seen in some of the papers I've reviewed is that I get to the end of the paper and there's new information introduced that was not in the body of the article. It's like a complete surprise. It's like, where did this come from? So be careful about doing that. You don't want to ever introduce new information in the conclusion. That's got to match what the data was presented. And here's the piece I wanted to share with you about data. Increasing numbers of anecdotes do not equal data. So don't confuse anecdotes with data. Anecdotes are fine. I've just used some anecdotes with you about why I read Military Medicine Journal. But in an academic paper, anecdotes gathered together do not summarily result in data. Also avoid the military after action report format. It's not very interesting to the audience, and it doesn't lend itself to rigorous academic review. It's really, this is what I did on my summer vacation, and that may be of interest in some circumstances, but generally not something that our audience is that excited about. And I think that's all I have. I will introduce Nurse Talbot.
I am Dr. Laura Talbot. I'm a professor at the University of Tennessee Health Science Center, and I'm also a retired colonel and had the total privilege of serving in the United States Air Force Nurse Corps for 30 years. I am totally honored to be a part of the editorial board for military medicine, and I invite you to be an author and a reviewer and get involved with this journal. It's fabulous. It's a total opportunity for me to give back to the military in some small way, and I invite you to do that with us. What I'm here to talk about is preparing the manuscript and formatting the manuscript for a journal. Key to this is to read and carefully follow the author's guidelines. I personally print them out and just follow them very, very closely. Oh, thank you. The first, you start off with the cover page, which includes standard information such as the list of the authors, their affiliation, the title of the paper. Sometimes you'll put grant support in there, and very, very important is keywords that's going to be searched on with the paper. Next is the abstract. The abstract, there's two forms of abstract. There's a structured abstract and an unstructured abstract. For our journal, we use an unstructured abstract, but whatever format is used, you still put key information there, such as the purpose, the design, method section, results, and conclusions. What you want to do with this abstract, because it is accessible in PubMed, is you want to entice those searching to go to your primary paper. So you word it briefly and succinctly, yet enticing enough so they'll search and go to your paper and read it. It should be consistent with the manuscript itself, and it's very, very important for it to be brief, accurate, and clear, because there is a word count, and some journals use a character count, which is very, very limiting. So you have to be very brief, very concise, but yet enticing. Again, I recommend you read the author guidelines before you start writing, because different journals use different structures, which may vary from journal to journal. The typical structure is what I'm going to present, which is the introduction, the methods, the results, and the discussion section. So let me first start with the introduction. The introduction is why the study was done. Usually it starts off with a discussion of the problem, why it's significant to military or federal health care, and then you usually end that introduction with the purpose of your paper. Next comes the methods section, which is what was actually done. In the methods sections, you put the design, the instruments used, the procedures, and the analysis. One key thing that I need to mention, especially if you're in grant or proposal mode, you usually write in future tense, but for a journal, you use past tense. Next is the results section. This is actually what did you find in the results. Tables are the most effective way of presenting detailed and complex information clearly and succinctly. I know when I do my intervention studies, I have tables that are used to compare groups that are going to be analyzed. Tables, figures, graphs, charts, diagrams, what they offer is the advantage of allowing the reader to visually see trends and patterns much easier than you'll typically see in a text. Tables and figures, I must caution you, are very expensive to produce in publication and should be used very wisely by the author. Another thing is, when you do put in a table or figure, don't forget to reference it or refer to it in the text itself. And lastly, usually the beauty of a table or a figure, it provides sufficient details for the reader to understand and even replicate the data analysis, but to avoid excess details. Statistical analysis. The statistical analysis is based upon your study design. For a well-planned study, it is recommended a statistician be consulted, and I usually bring the statistician in as part of my research team and get them involved very early on in the planning stages. It also depends on the level of complexity of your particular study if you want to use a statistician as a consultant or actually a part of the research team. My studies tend to be very complex because they're randomized controlled trials, and I know I'm going to have missing data, so I bring them in right away. The sample size, it needs to be adequate to answer the question, and typically what is used is a power analysis to determine your sample size. Bias, imprecise denominators, variable timeframes, and subjects lost to follow-up are very complex issues. And I know my statistician says he cannot save a poorly designed study at the end of the study. And that's why he says, please bring me in early. Again, I can't emphasize the importance of a statistician consultant. The discussion. The discussion is, what does the study mean? The first sentence should clearly state what was found and why it's important. It should compare and contrast findings with the literature. And it presents the strengths and limitations of the study and recommendations for future research. It is also important not to overstate the implications or findings. Conclusions usually are a very short paragraph that highlights major findings. It's kind of a summary paragraph. A few caveats, obviously I'll repeat it. The plural of anecdote is not data. Here are a list of a couple more anecdotes, but one that's not listed that I find very, very important is that clinical significance differs from statistical significance, and it is frequently overlooked. Now, common errors. I'm going to group all these into one statement, and it's proper grammar. The use of colloquial and slang language is a common error. Cliches are a common error. But now we're getting into subject and verb disagreements, technical jargon, Anecdote and pronouns, again, all these relate to proper grammar. Also, word confusion, such as that or which, affect versus effect. What I usually do is I get an outside reader and ask them, will you read this? And see if it makes sense to you. And if it does, I feel like, ooh, I've done a good job here. Here are a few more common errors that you see in manuscripts. And the first one is the use of acronyms. And I know I'm really good at doing this. When you put in an acronym, what you need to do is write out what the acronym is, like an improvised explosive device, and then parentheses, put the acronym there, IED. What the second common thing, and as a reviewer it drives me nuts, is when they use too many acronyms. So you have to flip back constantly trying to remember what the acronym meant when they use too many. So you need to judiciously use them, but I understand when you have a word count, you try to minimize the words, but it also makes it easier for the reader if there's fewer acronyms in the paper. Other things are mainly related to writing style, which is a lack of transition between paragraphs, lack of introductory sentences to a new paragraph, active versus passive words. But there's one little thing. I know I'm very dependent on my spell checker, but spell checkers will not pick up differences between their, T-H-E-R-E, and their, T-H-E-I-R. And that's when it's really good to have another reader read it. Datum is singular and data is plural. The other thing, and I'm guilty of this too, is being too wordy. And when you go over your word count, it is really hard to cut. So failure to be concise is another error. But with the word counts, I think you pick it up really, really quick when you get over that word count and have to cut. So thank you very much. And now Dr. Hafner.
Thank you. Before I get started, well, first of all, let me introduce myself. I'm Dr. Bill Hafner. I'm professor of obstetrics and gynecology at the Uniformed Services University and retired public health service officer. A career started with Indian Health Service for 10 years on the Navajo Reservation. And then the rest of my career has all been in the DC area. And when I became editor of the journal, it was a whole new challenge and a privilege and opportunity for me. And one of the opportunities was moving into the editor role with the managing editor of the quality and skills of Tanya Lira. And Tanya, please stand up so you can be recognized, because Tanya is really the glue behind everything. She makes it all happen. Without Tanya, nothing will happen. You think the editor has the real job? No. Miss Lira has the real job, and I can't say enough about the importance of her work and the skill and commitment and dedication that she puts into her work. Tanya will be leading a discussion group at the end of my presentation, and she'll be down here, and I'll go over this again, but she'll go through some of the technical, mechanical aspects of manuscript submission through editorial manager. And can you go back to the slide? Yeah, so that screenshot is an editorial manager screenshot. This one is for review rather than submission of a manuscript, but the screens look almost the same. And she's going to walk anybody who's interested in the technical aspects through the manuscript submission process. And I will then lead a group in the other corner of the room on the why do this, what do we get out of this in our careers, or what is our responsibility as authors, and we'll do the more general discussion. So we'll break out into two different groups shortly. So I'm going to go through the review process a little bit. And what is the role of the peer review process? Well, it is the scientific basis of what we do. It adds tremendous validity to everything that we do. And you know that anything that is published, as has already been said, has been critiqued by at least 2 reviewers who have skills and abilities and knowledge in the area and the topic of that article. And they are really the unsung heroes of our operation. For peer reviewers who are in the audience, for us, or for any other journal, I just say thank you. Your work is invaluable. Because the reviewers perform the most detailed reading of a manuscript. And they do this careful reading and provide the confidential comments to the editorial staff. This is great, it really needs a lot of work. I'm not sure the authors are going to be really able to respond to what needs to be done, or the article needs a couple tweaks. They're confidential comments to the editors. The comments to the authors then come through either editorial manager, directly typing into editorial manager, or by a Word file or WordPerfect file that can be attached in editorial manager. But they provide the more detailed comments to the authors. And we emphasize that the comments should be in constructive language. Every once in a while, a reviewer can go off on a toot about something that we as an editorial staff don't feel will be viewed constructively by the authors. In fact, it could be a turnoff to the authors. And we as editorial staff have then the responsibility either to go back to the reviewer if the overall tone of the review is not acceptable in our judgment, and we'll have a private discussion by email with the reviewers or by telephone. Or if it's just a word or two that needs to be tweaked, we may just delete or modify a word or two. But we try to keep this all in a constructive language. The authors are blinded to the reviewers. We're a single-blinded process. Some journals are double-blinded, but our reviewers know the authors and the author's institution, but the authors don't know the reviewers or the reviewer's institution. So it's a one-way blind, not a two-way blind. And 2 reviewers at least are assigned to each manuscript. If the decision is fairly straightforward, both reviewers say, yeah, some modifications, some tweaking will be helpful, then we'll just go ahead with that. But every once in a while, we get a review back where one reviewer says, this is great. Another reviewer is going to say, this is not worthy of publication. It's not worthy of space in your journal. Then what do we do? And how do we resolve it? Sometimes it's pretty straightforward, but usually it's going to involve a third reviewer to provide a consultative input to us. And that's where our members of the editorial board come in very handy, because they get these complex decisions to help us with, to be fairest to the authors and fairest to the journal. So the ideal peer review provides actionable recommendations to improve the manuscript. The ideal length is not 3, 4, or 5 pages long for a review. Now, some of our reviewers get pretty verbal, and others have trouble putting more than 4 words into a review. Our ideal is somewhere around 2/3, 3/4, or a full page with meaningful comments to the authors. And even if the recommendation overall is for rejection of a manuscript, we look to the reviewers to provide some length of detail so that the authors understand this is what needs to be done the next time with my next manuscript, or I'm going to take this very seriously. I'm going to rewrite the whole thing and submit it either to our journal again, identified as a new submission of a rejected manuscript, or submit it to another journal. You're welcome to do either way. We welcome a rework of a rejected manuscript, but you're also welcome to submit it to another journal. It's rare for a manuscript to be accepted on the first submission. So always expect comments from the reviewers for modification or revision. And it's essential to address all the comments that a reviewer offers. If only 2 or 3 seem reasonable to me, I didn't like the other comments, so I'm only going to respond to 2 or 3 of the recommendations. The editorial staff is going to say this is an unsatisfactory response by the author to the recommendations of the reviewers, and we'll either reject the manuscript right at that point, summarily, or send it back to the authors asking for a more detailed analysis of the reviewer's comments and a more detailed response. So all recommendations have to be addressed, but don't delay in too long in striving for perfection, because time's going to move on, and so our work needs to be timely. And if you get a rejection letter, please maintain a sense of perspective and then move ahead. Acceptance criteria, yes, we have guidelines, but no, we do not have hard and fast rules as to what qualifies for acceptance of a manuscript. Our reviewers and editors serve as mentors to improve manuscripts, sometimes suggest another venue or a fresh look. This is a great article, but it doesn't belong to our audience. We pre-screen all of our manuscripts, and if it doesn't seem to be appropriate to our audience, the manuscript will not be accepted for peer review, but there is no penalty associated with it. The authors can then freely submit to another journal without having to acknowledge that it was submitted to us because we didn't reject it. It just said doesn't fit. So pick another venue for it. And what we look for then is interest to readers of our journal. We're looking for absence of fuzzy thinking. We're looking for absence of major flaws. And we're looking for the presence of appropriate format, style, and clarity of the work. For reviewers, the same principles hold true. We're always looking for good reviewers. If you would like to be a reviewer and do not yet serve as a reviewer for us, the application is on our website under submissions, and just fill out the application. Tanya will screen it, I will screen it, and you'll get into our panel of reviewers. And we match your areas of interest with the articles. So do include a current CV with your application. You can expect to review 2 to 4 manuscripts a year. It's not onerous, but if you're going to do a serious review, any review is going to take at least several hours to do properly. So it's a major commitment. It shouldn't take days to do a review, but at least several hours should be devoted to a meaningful review. You'll get an invitation by email to your address of record, and if you're reasonably able to accept the invitation and address the manuscript, then say yes. If you don't have the time this time, just send a note to Tanya with that invitation saying, I would love to do it, but I'm going to be tied up for the next 2 months. There's no way I can do this now, but please keep me in your reviewer profile list. And if the topic is outside of your area of expertise, then suggest other reviewers who might be more skilled. and appropriate for us. As I said, the review process, the role of the peer reviewers cannot be overemphasized. It is very important. And at this point, we're going to break up. And I'm going to ask Tanya to take a group here. Whoever is interested in some of the mechanics of how do you deal with editorial manager, how do you submit a manuscript, actually, how does this get done, and all the what ifs. And I will address a group over in the back corner. We're not going to have microphones. The room is large, but there are not a large number of people here. So we're going to turn off our mics, and I'll move to the back. A couple of our team will move with me. A couple of the team will stay with Tanya. If everybody's interested in Tanya's work, we'll all join Tanya. If everybody's interested in the whys as opposed to the wherefores, then Tanya will join us in the other corner. So we're going to pause at this point, slide people, and you can unmic us for now.